Assalamualaikum and welcome to topic of delirium. We will start with delirium introduction. We will talk about what is delirium, clinical presentation, signs and symptoms of delirium, assessment, diagnosis and assessment tools, and also management of delirium via biopsychosocial approach. Let's first look into introduction. What is delirium? Delirium can occur as a consequence of a general medical condition, substance intoxication, substance withdrawal, or could be due to multiple medical etiologies. It often arises from an interplay of predisposing and precipitating factors. In general, the greater the vulnerability or the severity of insult, the higher the likelihood of delirium occurring. Delirium can arise from other causes such as sensory deprivation, and it is not always possible to firmly establish the specific etiology of the delirium in an older person. Other words have been utilized for this clinical presentation such as acute confusion, acute brain disorder, acute encephalopathy. The essential features of delirium are the disturbance of consciousness accompanied by a change in cognition that evolves over a short period of time, acutely, and cannot be accounted for by a pre-existing dementia. Looking at prevalence of delirium, 10 to 24% of hospital patients, it affects about 10 to 24% of hospital patient population. Incidence increases with patient complexity. 60% occurs in older adult patients and 60 to 80% incidence in those admitted to a medical ICU. About 80 to 90% in older adults with terminal cancer. Complications in missing delirium include those who experience delirium may also exhibit adverse effects such as aspiration, loss of independence, or decreased mobility. Although delirium frequently goes unrecognized in hospital settings, about 20% of all patients 65 years and older are usually affected. When delirium is not recognized in a hospital setting, patients often face extended stays, increased complications, higher transfer rate to nursing homes, and more dependence on care after discharge. Delirium is a syndrome which consists of three types of presentation. These include hyperactive, hypoactive, or mixed type. It is an acute brain failure which may occur abruptly, and it is characterized by acute disturbance in consciousness, reduced ability to focus, sustain or shift attention, occur over a short period of time, and fluctuates over the course of a day. Potential causes of delirium include inadequate pain control, drug or toxin, metabolic disorders, complications from a systemic disease, neurovascular insult, systemic organ failure. It is very important to figure out the trigger. Often, combination of several of the following becomes the trigger of delirium. These include drug use, hypnotics, anticholinergics, electrolyte abnormalities, lack of drugs, infection, reduced sensory input, intracranial problems such as stroke, urinary retention and fecal impaction, and myocardial or metabolic problems. This can be summed up in an acronym of delirium. The reported risk factors for delirium in hospitalized older persons include social demographic of advanced age, male sex, residence in an institution, little contact with relatives, mental status, those especially with dementia or cognitive impairment, those with depression, medical illness and medication such as severe medical illness, multiple medications such as narcotics or psychotropics, fracture on admission, physical status such as fever, hypotension, vision or hearing impairment, pre-existing functional impairments or disability, limited pre-morbid activity levels, laboratory findings such as high urea creatinine ratio, sodium or potassium abnormalities, hypoxia, surgery and anesthesia, non-cardiac thoracic surgery, aortic aneurysm repair, unplanned or emergency surgery, or immobility after surgery. Others include alcohol abuse, urgent admission to hospital, frequent admissions over the previous 2 years.